All right. Well, I see that we have a handful of participants who are here already, and I like to stay timely with things. So we will go ahead and get started. So thank you, everybody who is joining us this evening. My name is Catherine Goodman, and I'm the Public Relations and Communications Manager for the Blue Ridge Health District. I'm joined here today with a few colleagues, including Dr. Denise Bonds, who is our health director for the district, Ryan McKay, who is the Director of Policy, Planning, and COVID Operations, and Jen Fleischer, who is our COVID Response Project Manager. We have a number of things to discuss with everybody this evening. We will be providing a handful of updates. And Joe, if you can bring us to the next slide. All right, so here's our agenda. We're going to talk about some data, where we stand with our COVID cases and the high transmission, talk about school guidelines and changes in our contact tracing efforts, booster shots and vaccines for 5 to 11-year-olds and where we stand with those plans and what our next steps are, and testing resources. We then will go over a number of questions. So we had a lot of questions submitted before today's town hall, and we will try to take as many questions live as possible. We won't be able to comment on any specific cases or any specific school policies, but we'll try to provide as much information as possible. And we'll provide resources for where people can email us or call us for questions afterwards. So we're going to go ahead and get started with some data information from Ryan McKay. So you can hit the next slide, Joe, as well. Thanks.
Thank you, Catherine. Thank you, Joe. First, we have our data from today, and this is on our BRHD data portal and dashboard. You can see on the right of the screen where we currently are with our surge. So things have really picked up since the end of July through August and September. And then you can also see where we've been throughout the pandemic. Our biggest surge was in really mid-February into March and a little bit into April. And so it just gives you a little bit of a comparison of where things were then and where things are now, particularly with the Delta variant. And we're sort of in this position for a couple of reasons. Obviously, Delta, as we all know, is much more transmissible than previous variants and what we've experienced with COVID. It also sort of coincided with the expiration of a lot of the mandates that had been in place: masks, distancing, limiting numbers and social gatherings. And so we have this combination of a new variant that's much more transmissible and us opening up far more than we were in previous periods of the pandemic. Next slide, please. So to kind of introduce this a little bit, we've been meeting with schools, both independent and public, throughout the health district and local pediatricians for well over 14 or 15 months. It's a weekly meeting that we have to talk about really making sure how we're best implementing the strategies at the school level, at the classroom level, and obviously the bus level, to make sure that we're minimizing risk to the extent possible. And so part of that process is how we determine and establish the case investigation and contact tracing components. So just as a reminder, case investigations are when we interview a parent or guardian or an individual who is tested positive with COVID to get an understanding of when symptoms started, and then the activities that were taking place during their infectious period. And really what we're trying to do is get an idea of the contacts that they may have had, so we can let those individuals know that they may have been exposed. Previously, we've been getting line lists from schools with information about the school contacts, whether it was in the classroom, during athletics, other activities, or certainly on the bus. One of the slight changes that we're doing now is we're no longer contacting those close contacts that schools have already contacted. That would be duplicating effort on our part, and schools have been doing a really good job of communicating the different pieces that we would communicate as well. And so this allows us to really focus on any of the community contacts that children may have had outside of the school setting. So if it's at an extracurricular activity, or some sort of lesson that they take outside of any sort of school-related activity, we'll focus on that and certainly conduct some case investigation around the household. And so this is going to free us up to focus more on getting to the more broader community cases where we think transmission is actually occurring. So that might be from an adult to a child in the household or in other settings. And then we think this will really minimize impact on schools, potentially reduce the number of children that have to go into quarantine, because we have preemptively identified children as close contacts, ask them to quarantine for the appropriate time before returning to school. Next slide, please. One other thing, so it's really difficult for parents and guardians during this time because we're going to enter a phase, or we've already been through that phase, where children are just going to have runny noses. They're going to have a cough. They're going to have sort of symptoms that sort of mimic COVID. And it's a little frustrating if we have to take our child home from school for a day or two to really confirm what it is, but it's really important. On the right side, you can see here COVID or allergies, and you can see all of the commonalities between the two and how tricky it is for us to really determine if a child has allergies or if it's something more serious like COVID. And as we enter flu season, we enter what traditionally is more disease spreading within congregate settings or within schools. It's going to make that a little bit more difficult. And so the reason that we're asking schools and pediatricians to really work with families on really identifying what is causing the illness is critical, because that minimizes the risk of spread, and it makes sure that we can keep children where they need to be, which is in classrooms and schools. So when a child starts to develop symptoms that are consistent with COVID, we ask that they stay home, that they get evaluated by a doctor, a pediatrician, or that they go and seek testing for COVID. And then following school policies, you would then be able to return your child to school if it's not COVID. Again, this is really critical as we head into late fall and winter, when disease spread potentially may increase related to flu, colds, or other diseases that we typically experience. Next slide, please. So here we have a little chart, quarantine guidelines for unvaccinated or partially vaccinated individuals. And obviously anyone 11 or under is going to be fully unvaccinated. And so there are three options here that the CDC and the Virginia Department of Health have laid out, and what we try to implement here at the local level. The preferred option for a quarantine period is 14 days. And quarantine really means that an individual, whether it's a child or an adult, really stays at home. There's no extracurricular activities. There isn't going outside of the home. There isn't interacting with other children or other families, or in any situation that brings them into contact with someone else. The reason we do this is because we want to make sure that we're minimizing spread and risk to the community. So while a child or an adult may not ever develop symptoms in that 14 days, it is the preferred method because it presents the least amount of risk. There are options depending on the individual situation. So if it's going to cause financial hardship, testing isn't readily available, or there's undue physical or mental difficulties, there are options for getting out at 10 days. We'll say schools are making those policies on their own. We make the recommendations, we provide guidance, we support them through the different procedures and processes. The schools ultimately are making the decision based on the needs of their communities, their students, and their students' families. So it's really important that if you're notified about being a close contact, that you check with your school on the official policy. And then you can see here with a 10-day quarantine, there is some additional risk involved. And what schools are doing is adding different layers and strategies to make sure that we're minimizing risk, regardless if it's the 14-day or 10-day quarantine period. And with that, I will turn it over to Denise to discuss boosters.
Thank you. If I could have the next slide, please. So the first thing I'd like to do is distinguish between a booster and a third dose of the inoculation series. And these are often used interchangeably, but they're really two different entities. So we are currently offering third doses for individuals that were immunocompromised and have not received an adequate immune response from the first two shots of an mRNA vaccine. And those third doses are only if you started, if you go back, with an mRNA. There we go. We've been doing this now since the middle of August. And you can register on our website. If you fit the criteria for immunocompromised, you don't have to bring any proof of immunocompromise. It's really self-declaration. And the best person to decide if you meet that criteria is really your primary care doctor, or the doctor that you seek care for your medical condition.
Dr. Bonds, we're having a little bit of a difficulty hearing you. If you can speak louder please.
Yeah,
Thank you.
let me see if I can.
Does that work better?
That sounds much better. So you may need to repeat a few things that you just shared. Thank you.
All right, I'm sorry. So third doses for people who are immunocompromised began on August 13th. And as I was saying, you don't have to bring any proof. You can self-declare. And the best person to speak to, if you believe you're immunocompromised, is your primary care physician, who can help you make that determination if you need that third dose. These are really for people who just got the mRNA, so the Pfizer or the Moderna. We don't have any recommendations at all regarding immunocompromise and Johnson & Johnson. Last week, the advisory group for the FDA met and reviewed all of the evidence regarding waning immunity and whether a booster dose, so this is an additional dose that would be given to either all or a select group of individuals because their immunity is beginning to fade. So they mounted a good immune response to start with, but just over time it's fading. So they recommended a booster dose of Pfizer, which is the only vaccine that has sought this so far, given at least 6 months, but only to individuals who are 65 and over or high-risk individuals. That now has to be accepted by the FDA. And then the ACIP meeting, the Advisory Committee on Immunization Practices, has to also agree and adopt or vote on a recommendation that's then adopted by the CDC and ultimately VDH. So the ACIP meeting is happening right now. It happened all day today and it will be tomorrow, but so far the FDA has not accepted their advisory group's recommendation. So at this point in time, we cannot offer booster doses to anyone. We are making lots of preparations about that, as you'll hear shortly. So next slide. All right, Jen, I believe you're going to talk to us about where we can get boosters.
Yes, thanks, Dr. Vance. So our planning for boosters involves providing that Pfizer booster dose at some specified locations that are already functioning throughout the district. So far we are planning to offer that booster at Moby on the Mall, which it happens on Mondays on the Charlottesville Downtown Mall from noon to 3 p.m. at our J. Crew mass vaccination site in the Fashion Square Mall. We have a partnership site with Centera and other partners, Move to Health, at Cherry Avenue Shopping Center. And that also occurs weekly on Thursdays from 11 a.m. to 1 p.m. Each local health department in the different counties that we serve has a day a week designated for vaccinations, and that will include boosters once they're approved. And our homebound service through a partnership with UVA Health and the Charlottesville Fire Department will begin offering boosters to eligible clients who have received that through the homebound service for their first and second doses. As Dr. Bond said, right now, how we get boosters is a little bit unknown in that you will need to meet the eligibility requirements that are set forth from ACIP, VDH, and that that FDA approval. So it's a good moment to kind of make a reminder that, again, we do not have access to administer boosters at this time. And once that booster is recommended for you, should you meet those eligibility requirements, 65 and up right now, and whatever high risk will be defined as by the FDA, there isn't a huge rush to go get the booster right away. The real urgency still remains in fully vaccinating people who remain unvaccinated altogether, including that 5 to 11 group who is unable to be vaccinated. So the booster, the first and second dose that you've already received still offers a great amount of protection against illness and hospitalization and death, including that Delta variant. So we will wait for those eligibility requirements, and they will be necessary in order to make an appointment, which is the second step for getting boosters with BRHD. So all booster shots will be by appointment only. And then we will apply the time limits after the second dose. Right now, it's recommended that you're 6 months from completing your series, your 2-dose series. Again, at the moment, it seems that only the Pfizer vaccine will be used for boosters, and we do not have further information as to whether that will be combined to offer a third dose to those who received Moderna for their first and second doses. So we await that information. Joe, if you can proceed to the next slide, I'll move that conversation now into vaccinations for 5 to 11-year-olds that I just mentioned. So Pfizer yesterday reported its phase 2/3 clinical trial showed that there was an effective and safe response in children 5 to 11 years using that 2-dose Pfizer regimen, much like the 12 and ups, but at a third of the adult dose. So that's a 10 microunit dose. The study included 2,268 participants who were of that age, and Pfizer will now request from the FDA an expansion of its emergency use authorization, its EUA, to allow for the 5 to 11-year-olds to become vaccinated. So similar to the booster plan, we don't yet have information as to when that will come into play, but we are, like boosters, making plans for that. So we are already partnering with pediatricians throughout the district in hosting vaccine clinics for 12 and up, and we will continue those plans for the 5 to 11 set in providing not only vaccine, but staff to host larger vaccination clinics for youth. We also will stand up additional vaccination sites that will include quiet spaces for kids and trained pediatric nurses. We know that this is a specific population and has special needs for some children, and making 5 to 11-year-olds comfortable is an easier and more efficient way to administer vaccines. We will support local partners with vaccine and administrative support. So family practices and our partners at UVA, we are talking about assisting with clinics for that age group. And we've also spoken to independent schools and public schools in the district, and they are very looking forward to partnering with us to provide after school and potentially weekend clinics to serve students at pickup and in Saturday and Sunday offerings to help ease the burden of getting vaccinated for families. Finally, we intend to have boosters offered at, vaccines for 5 to 11 offered at the local health departments, and are looking at the need for increasing our offering at those departments to an extra day a week. So we will, again, wait and hear what comes from those decisions about this age group, but are in the works with getting that prepared. And Catherine, speaking of that age group, the hot topic, testing, if you'll take it from here.
Yes, I will. So Joe, you can go to the next slide, please. All right, so testing, as Jen mentioned, we have received hundreds and hundreds of calls over the past few weeks to our hotline in regards to testing resources. So I wanted to remind folks of what testing is available in the community. So on here, you can see Monday and throughout the week. So I'll start with going over a few of these dates. So Monday through Thursday, the health department is offering free testing at every locality throughout the health district. So for example, on Monday nights, we're in Green. Tonight, we were testing in Fluvanna. So we're rotating to make sure that there is free testing at least once a week throughout every locality. On Monday nights, there's also testing hosted by UVA Health at Church of Incarnation. Tuesday nights, there's testing at Mount Zion First African American Baptist Church. Those are both sites that are in Charlottesville. And then Wednesday through Thursday, the health department is hosting testing in partnership with Next Molecular, which is a local lab, which we call a turnkey lab, where they're actually able to come and provide all of the assistance that we need to have fully functioning testing sites. And so with this, the important reason I'm mentioning that it's from Next Molecular is because that's the lab that will be providing results for these testing. sites. So whenever there's confusion about getting test results and someone's calling you and they may not be from the health department, it's because we're using a partnership through this lab to get you tested. And then on Friday nights, which seems to be a popular site, we're continuing the testing at Fashion Square Mall. And so these Wednesday through Friday nights are all outside of the former JCPenney location in the parking lot. And we know that the sites are getting very busy, and we are fortunate to have so many community partners to be able to host these sites, and want to remind folks that there are sites throughout the district. So while there might be a long line in Charlottesville, the line might not be as long in Louisa. We know it's a drive to get out there, but we are hosting sites throughout the district, and we're encouraging everyone from the district to go where you may need to go. And if it's driving 45 minutes versus waiting in line for an hour, you can make that choice yourselves. But we want to let you know that these sites are available, and we won't turn anyone away because of where they live. We want to provide as many resources as we can. And there are also continued testing at local pediatricians, primary care providers. The pharmacies in the area are offering testing. We understand that these tests are going quickly and appointments are getting scheduled pretty quickly, but they are still available. And then also our testing sites, what we've seen lately is that while there may be long lines, at least at the health department sites, we aren't necessarily running out of tests. It's more that we're running out of time. And so we're working on a new process starting this Friday to make our lines more efficient, to get folks through even quicker. And again, we have sites throughout the localities in the surrounding counties that aren't filling as quickly as the Charlottesville sites. So those are always an option. Our schedule can be found online. So folks who are looking on their computers, or if you're watching on TV, you can actually scan this QR code on the screen, and this will bring you directly to our testing page. It's blueridgehd.org is our website. Our testing page is updated frequently. Whenever there are pop-up test sites or weather delays like there were today, we're updating our site as quickly as we can. Another thing to mention is that UVA is hosting a drive-through testing clinic tomorrow night primarily focused on students, and all of that is also on our website as well. So we'll provide as much information as we can for testing, and the result turnaround can be about up to 3 days. And so we want folks to be able to plan ahead and know that it's not necessarily set up for travel, but of course we'll provide that documentation if necessary. The test results just may take a few days. So if you're traveling tomorrow, I'd suggest you get tested. You should have been tested a few days ago. So those are the latest testing plans, and we will go to the next slide. So what can you do? Here's our call to action for everybody in the community. We want to remind you that getting vaccinated is still going to be one of the best ways that we can end this pandemic. It's safe and effective, and the more individuals who are vaccinated, the less likely there will be chances of more mutations and variants developing with this COVID virus. And then we're also encouraging folks to wear a mask. And I understand that there were a few months this summer where our cases were pretty low. The mask mandate was lifted, but it is now encouraged. We have high transmission throughout the district, and we recommend that if you live in a household with someone who is at greater risk for COVID, whether they be immunocompromised or someone who's unvaccinated, we encourage you to wear a mask in public. And to also limit your large indoor gatherings with others if you're living with folks, again, who are immunocompromised or not vaccinated at this time. So we also received a large number of questions. So we'll go to the next slide, and I'll remind folks that this is our hotline. We have a Gmail account where you can email us as well. Our hotline has been inundated with call volume over the last few weeks, and we apologize. We know that the calls are taking a little bit of time for folks to get through. We're increasing our staffing. If you're interested in working on the hotline or volunteering, please email us and let us know. We're working as best as we can to answer calls as quickly as possible, but our Gmail and email account is another way for folks to reach out to us if you have questions. So if you submitted a question tonight or you asked one today that we're not able to get to, please feel free to email us and we'll follow up with you within a few days. We can turn around pretty quickly on the emails within a day or so. And then also just a reminder that vaccines.gov/search is where you can find all sorts of vaccine appointments throughout the district and throughout the country. So you'll be able to go there to find any vaccine resources that you may need. So if you have a loved one in another state that needs a resource, you can send them this website as well. But I'm now going to open up into asking a few questions. We did have a large number of folks submit questions in advance, so thank you to all of you. We will try to get to as many as we can in the next half an hour. And I see we already have a number of folks who have submitted Q&As on the Zoom account. So for those of you who are on Zoom, on the bottom of your screen, there should be a Q&A button, and this is where you can click to type in your question. Again, we'll try to answer as many as we can, but send us an email if we don't get to it. So I'm going to start. We had a few questions to start regarding contact tracing and case investigations. So let's start here, Ryan, and talking about quarantine. If you could tell us, if someone has been fully vaccinated, do they need to quarantine if they are exposed to someone who tests positive?
No, if someone is fully vaccinated, they do not need to quarantine. What we recommend is that they monitor for symptoms and then they seek testing, PCR testing 3 to 5 days after they've been exposed to determine if they have COVID or not. But no, individuals do not need to quarantine if they are fully vaccinated.
You're muted, that was my fault. Okay, and then speaking of quarantine, one of the chats that we had in our questionnaire here is, how do we know that quarantining children as a result of being a close contact in the schools is working? Do we have any data that shows the percentage of children in quarantine that are testing positive? And are the schools or BRHD tracking this?
I can take that. Yeah, I can take that one. I did read that before, and it's a really good question. I think there's a couple of different pieces to that. So quarantine works provided that the individual is isolated from other individuals, because if they develop symptoms, then they obviously could get someone else sick. I think one of the things that we track, we can't really share specific data, but we have very few instances where transmission has occurred within school settings. We don't have any reported outbreaks in any schools right now. We had very few outbreaks reported last school year. And what that really tells us is that the mitigation strategies that the schools are implementing are working. Distancing, making sure children are masked, making sure that when someone within the school has symptoms, that the parents are notified very quickly and then picked up. So we just aren't seeing in-school transmission, which I think is really a testament to what the schools are doing on a day-to-day basis to really protect and minimize risk. But we do know quarantine works if individuals are staying inside their homes, should symptoms develop, or even if it's an asymptomatic individual who is infectious. It does work if individuals are staying inside.
Great, thank you. All right, and then I see a few other more technical questions about the vaccine. So one of the questions is it necessary to wait 8 months after your last shot for a booster shot? So Dr. Bonds, I'll ask you to answer that.
Right, so it depends is I think what the answer to that is. So right now what we have is data and a recommendation from the advisory group that reports to the FDA that a certain group of individuals, people over the age of 65, perhaps individuals with high-risk medical conditions, get a booster at 6 months. There likely will be additional studies done, and we may see that change over time, and we may see different recommendations for different vaccines depending on the type of immune response that was generated at the beginning. So right now, we don't have any firm recommendations or any firm approval for boosters. So the answer is wait and see, and we will give very clear, explicit guidelines on who is eligible for a booster and the timeline for that as soon as we have the full approval process.
All right, thank you. And then we're also receiving quite a few questions about flu vaccine. So talk to us about recommendations for getting a flu vaccine this year, if there's a time frame people need to wait in between the flu vaccine and COVID vaccine, or if it's okay to get them at the same time.
Yeah, absolutely. People should get a flu vaccine. It's really critical that we don't have people that come down simultaneously with the flu and with COVID. So we 100% recommend that everyone get a flu shot every year, and particularly this year. You can get them at the same time. Initially, early on, when we had less experience with the vaccines, we were recommending that you have a 2-week window between vaccines, but that's been lifted. We have more experience now, and we know that it's safe for people to get a flu vaccine and a COVID vaccine on the same day if you'd like, actually. So you don't have to wait. please do get your flu vaccine. And if you want to get all of your shots on the same day, sign up for both.
Okay, great. Thank you. All right. And then Dr. Bonds, we have a few other questions for you that are a little more technical. So there are a few questions people submitted asking about immune response and wondering if there's a way to test an individual's immune response at a given time post-vaccination.
Yeah, so these are really great questions. The answer is, it depends. So we can absolutely run antibodies, and you should talk to your doctor about this to see if you have had a COVID infection. We can run a pretty specific type of antibody test to make sure that you've developed antibodies to your vaccine. What we don't know is what degree of antibodies in your body. So when you get that result back, how positive does it have to be to know that you have good immunity against getting COVID? We just don't have that understanding right now. We'll certainly do lots of studies going forward to try and understand that, but at the moment we can't tell. And so there's no recommendation to get an antibody test to track your response. And there's really no recommendation necessarily to get one to see if you still have antibodies if you had COVID. The other thing to remember is that your immune system has lots of ways to respond. Antibodies are one, but there are also other cells that respond to an infection like COVID, and we don't measure that other antibody response. So at this point in time, we don't really know which is the most important. Are antibodies more important than the other cells? What level of antibodies or other cells do we need to have? So I think if you are worried about whether or not you had COVID, it's reasonable to talk to your doctor about whether or not you should get an antibody test, but I wouldn't use it to determine my immunity either way.
Thank you. All right, and we have a number of questions, so I appreciate folks submitting those and those who submitted them live or in advance as well. So Ryan, I have a couple policy related questions for you. If you could tell us, what are the current executive orders in Virginia for COVID restrictions in the state, and or are there any locally?
The only ones that are in place right now are related to schools, K through 12 settings. So everyone is mandated to wear a mask regardless of vaccination status in K through 12 settings. That's both independent and public schools. As far as other ordinances, it depends on the individual local government about their own building policies, but there are no mask mandates in place right now. Social gatherings do not have limits on the number of people who can attend, and businesses are free to have as many people in per their regular occupancy rates. So for restaurants, grocery stores, there are no changes. Individual businesses may have their own policy regarding masking. So obviously you would want to check with those policies, but there's nothing at the state or local level beyond what's happening with the schools mandating masks.
Thank you. All right, and then let's move to a few things about 5 to 11-year-olds. So looking at scheduling, we received a few questions in advance about if pediatric offices will have the vaccines and how BRHD will be administering them. And we've talked about a few of those, but Jen, could you share with us how people will be able to schedule appointments through the health department to get their 5 to 11-year-old vaccinated? And will we be opening any pre-registration?
So right now we are working with our tech team to customize the current system, which is called VASE Plus, and that's how everyone registers for a vaccine or as a walk-in is integrated into the system for a vaccine, so that it's suitable for questionnaire for 5 to 11-year-olds and for recording that vaccine episode. That's kind of part one of that pre-registration process. We won't necessarily open to pre-registration because we may not be given enough time for that. Again, we don't know. It's a wait and see to determine when that will be available, and there may not be a long enough window to offer pre-registration ahead of that authorization. But certainly once authorized, it will be very similar to how folks schedule a vaccine now. It's choose a day and a location that work for you and sign up, signing with a consenting adult to allow that 5 to 11-year-old to come with you to the site. At these sites, we have lots of plans in place. We're considering standing up a drive-through site, potentially with the help of Albemarle County. We're considering specialized sites within current sites, and again, these additional offerings at the local health departments with the support of additional pediatric and public health nurses. So as all these plans take place, the registration will happen online or through our hotline or in person. But the parental consent piece and the adult that comes with the child will be a crucial piece to getting this done smoothly and with the least inconvenience for families and the children being vaccinated. Catherine, did I miss any parts that you need answered in those bits?
I think that was pretty comprehensive. So
Okay.
Thank you.
Great.
Good. We did also get a few questions, Jen, here asking about ACIP and who we're waiting for these final approvals and next steps. And I know Dr. Bond spoke on this briefly, but can you remind us who are we waiting for that approval from ACIP or a recommendation from CDC?
For the 5 to 11-year-olds, is that, or the boosters?
Why don't you share for both?
Okay, so I'll do my best, and Dr. Vance can correct me when I go astray because I'm now blending the two. For the boosters, we are waiting for ACIP's recommendation to be taken up, and then once that is approved, then VDH will review that and let us know how we may distribute the vaccine. So it's almost hand in hand that the recommendation is done verbatim, but there may be some pieces of administration that we need to take into account specifically for the state of Virginia that VDH could ask us to adhere to when we administer locally at BRHD. So generally speaking, once ACIP is approved, then VDH tells us, okay, yes, you may go ahead and administer, and here's how. And then usually it's a pretty quick turnaround once those decisions are made. Often there's a week to 10 days between that decision and an actual first appointment on the ground. For the 5 to 11-year-olds, it's a little bit of a longer process right now. The Pfizer must appeal to the FDA with its data from its clinical trial, and then the FDA must review that information and then go through this very similar process with the boosters and determine again how to promote that to ACIP, and then once ACIP accepts that, letting VDH determine how we will administer the 5 to 11s. Again, we don't have a specific date on that. Obviously, Pfizer would like that pushed through as quickly as possible, and so would anyone who has a 5 to 11-year-old at home. But we are waiting and watching and optimistic that the results of those clinical trials will be approved smoothly, and we're ready to administer once we get the go-ahead.
All right, great. Thank you. All right, and Dr. Bonds, a few questions about booster shots. So folks want to know if J&J will provide a booster shot, and in general, what some of the reactions may be when folks get a booster shot.
Yeah, it's a great question about J&J. They did just release a scientific study that showed that doing a second shot 2 months after their first shot really increased the response to the vaccine and really improved its efficacy. That data has not, that I'm aware of, been submitted to the FDA, although I'm sure they will be moving that forward to the FDA. And again, it's the same process. FDA has to review the data, go through its advisory committees, then it goes to the CDC and their advisory committees. And ultimately, if those bodies recommend it, then VDH accepts and moves forward with that. That can be done very quickly. We know early on that they move through those emergency use authorizations quite quickly. And so if Johnson & Johnson moves forward with that, I would anticipate that it would take a few weeks really to get to that point. So that's Johnson & Johnson. And then side effects that you might have with the booster, that's a really great question. I would anticipate you might have, if you had side effects the first time around after your second shot, you might experience some of those same side effects again. But we won't really know at this point in time what people are going to experience. But typically when you have these delays between shot series, if you experience some side effects after the first round, you often experience some side effects after the second round. And again, that's a good thing. That's your immune system working and responding to the vaccine. So don't be dismayed by that. Take some Tylenol or Motrin or your favorite analgesic and just plan for a day in bed if you need it.
Thank you. All right, and one more J&J related question. For folks who received a J&J vaccine, and at this point, we don't know when a J&J booster shot will be available, but if Pfizer becomes available soon, should they get a Pfizer shot as well?
Well, that will depend on what the recommendations are that are given to us by both the FDA and the CDC. Because these are emergency use vaccines, the only one that's been approved is Pfizer in individuals 16 and over. We have to very carefully follow the CDC guidelines. We can't really step outside of that, which is different than other medications that physicians prescribe. So I think it's really important for people to understand this is not our interpretation of how these vaccines should be delivered. These are the guidelines that we're given, and we have to operate within those guidelines or we can lose our ability to provide these vaccines. So if the FDA and the CDC recommend that we do a booster with an mRNA vaccine like Pfizer to individuals who initially got Johnson & Johnson, then we absolutely will provide that. But if they don't make that recommendations, we cannot provide that.
All right, and one more vaccine specific question for you, Dr. Bonds.
Sure.
If an individual tests positive for COVID, is it true that they have to wait 3 months to get the vaccine?
Well, that's what the recommendations are. You don't have to. You certainly should wait until you feel better and are no longer infectious. You have antibodies from that COVID infection, and we think that you probably have pretty good protection against becoming infected again for about 90 days or 3 months after that. And that's where that recommendation initially came from. But if you are, for example, going to be traveling and you want to get your vaccine series done before you leave, I think that's perfectly fine. We're certainly not going to withhold the vaccine because of that. So we would just ask that you certainly wait beyond your 14 days, make sure you're feeling well before you start that vaccination series.
All right, thank you. And I see we have a number of questions asking about testing that we will talk about in just a moment. And as a reminder to folks, we will have this webinar recorded as well, so people can watch this afterwards or look for questions. And if we aren't able to answer your questions, please send us an email and we'll get back to you soon. So Ryan, this may be a question for you related to quarantine. With the vaccine being less effective against the Delta variant, why are we not also quarantining the vaccinated? The majority of people I know that have been infected and that are vaccinated, and some even spread it to their families, so it wasn't an isolated incident.
It's a really good question. So looking at the most recent data from the Virginia Department of Health, what we know is that of the 4.9 million Virginians who are fully vaccinated, about 0.5% of that number have actually contracted COVID that we know of through testing. And individuals, it's about 0.019% have been hospitalized. So looking at that data, the overall data from people in Virginia, we know that the vaccine is highly effective and that quarantine really isn't necessary given the statistics that we have. It also demonstrates the importance of getting vaccinated. It is exceptionally done a great job at preventing the worst outcomes, severe illness resulting in hospitalizations or death.
Okay, thank you. And then I see there is a question about if we are seeing any variants locally, and I can answer to say that majority of our cases now are the Delta variant that we're seeing throughout the health district. Okay, so what I think we should transition over to is to talk about testing. We have about 15 minutes left. So again, if we don't get to your questions, please do send us an email and we will follow up with you. But let's talk about testing. So first and foremost, Ryan, why don't you tell us about who you recommend gets tested?
So individuals who should get tested are those that have COVID-like symptoms. And usually you would wait. Well, if you have symptoms, go ahead and seek testing as quickly as possible. Individuals who are asymptomatic close contacts. So you've been identified as an individual who was within 6 feet of someone who tested positive for COVID for 15 minutes or more over a 24-hour period, should wait 5 to 7 days into that after that exposure to go and seek testing. Again, getting a PCR test is going to be most advantageous as it's the most accurate. Individuals who are fully vaccinated should wait 3 to 5 days after their exposure if they've been identified, and then obviously monitoring for symptoms during that time frame. There are times that schools may require testing or medical evaluation for a child to return. And so that child may need to get tested to meet school policies for return to school. Again, check with each individual school or daycare or pre-K setting to determine what that policy is. Sometimes testing is going to be required for work and travel. This would be asymptomatic testing. And you might have to search a little bit to get that testing, but for those that are close contacts or have symptoms, those are the individuals that really need to get tested to make sure that we're identifying positive cases and then doing the investigation shortly thereafter.
Okay, thank you. All right, and one of the questions we received prior to today's town hall is, why are there extremely limited testing options in the area now? It seems harder to get a test now than it was in the spring. Is BRHD doing anything to increase the number of rapid tests, at-home kits, and other testing supplies to keep our youngest children safe at school? So I can at least start with answering. We shared information about our testing sites. We did increase testing starting in September so that we could we did increase testing in September so that we could meet the demand in the area. We saw there was quite an increase in testing needs when students went back to school, both with UVA students here and public and private schools, all of our K through 12 students as well. And all of our testing sites, BRHD has lowered the age limit. So we now can test anybody 6 months and older, so that we're trying to create more access. We do want children that have a lot of symptoms to make sure that they are also seen or at least consult with their pediatrician, because it could be something other than COVID, but we will of course continue to offer testing. And then with this, Dr. Bonds, I wondered if you could talk about rapid tests. There seemed to be a handful of questions relating to how accurate are rapid tests. Would you recommend someone uses a rapid COVID test before or after travel or after possible exposure?
Yeah, so rapid tests are really becoming widely available, and you can buy take-home tests at pharmacies. They're a little hard to find, but if you search around, they are available. So I think one of the important things to differentiate here is, are we talking about a take-home or a test that uses an antigen, or are we talking about one that you send off for PCR? The antigen test can be quite good if you are symptomatic. So there's been a number of studies that show that they do detect the antigen of the Delta variant, which is what we're seeing right now. They do have good accuracy if people are symptomatic and they're very close to their symptoms. So within those first 6 days, they work pretty well. They seem to work a little better if somebody else does the swabbing. I think that's because people are a little reluctant to put a Q-tip far enough up their nose to really get a good sample. But even if you self-swab, they still have reasonable accuracy. Where they are not so good is for widespread asymptomatic testing. They just have a lot of trouble detecting very low levels. So if you are infected, but you're not symptomatic, they might miss that test. They might miss that infection. They just can't detect those low levels of virus. And so they don't do a very good job at that area. They very seldom give what we call a false positive. So if they give you a positive, you're infected. But if you're not symptomatic, and you get a negative test, it could be what we call a false negative. That is, in a certain percentage of individuals, you will in fact be infected, but the test doesn't read. So if you have any concerns at all, you should go and seek PCR testing. And in addition to the health department, there are lots of other places that you can get testing. Many primary care providers and pediatricians offer testing. Many of the urgent care centers in town will offer testing, and pharmacies also offer testing. So there are lots of places where you can go and get testing. So pretty good sometimes.
Great. And I think you just shared a few places where folks can go for testing if they need it for travel as well. I know that was one of the questions, is where can people go for travel? If you do get tested at a BRHD site, we will provide documentation that you may need for traveling, whether it's domestic or international. And if the timeline doesn't work, if you need it pretty quickly, then that's when we recommend you contact your PCP or look at a local urgent care center to see what their test turnaround time can be. And you can send us an email and we can help you access that as well.
So Catherine, I just want to add in, if you need a test for travel, there are travel clinics. There are freestanding travel clinics here in Charlottesville and in other major cities. And I think it's worth looking at those because that's what they're designed for. They're designed to do those rapid tests and provide the documentation that you need for travel. So that's a really good alternative for getting that documentation.
All right, thank you. And Dr. Bonds, one more question for you. If you can share, you may not know this data off the top of your head, but what is the false positive rate of tests that are provided by the healthcare providers? So let's say a PCR test. What is the false positive rate?
Yeah, so very few false positives with either the PCR or the antigen. So if you get a positive test, you have the disease, you have COVID. The bigger concern, again, as I just said, is if you are asymptomatic, the antigen tests, which are usually the rapid test, have a not insignificant rate of false negatives. That is, you get a negative test, but you really are infected with COVID. So if you get a positive test, you've got COVID and you need to institute that isolation period.
Great, thank you. Okay, let's see, I'm pulling this up. So a few more questions related to 5 to 11-year-olds. There's a question asking who has reviewed the Pfizer study on 5 to 11-year-olds. So far, all we've heard is from Pfizer's PR. So who still needs to review that?
Yeah, so I'll chime in on this one. They issued a really great press release and put out their numbers, but they haven't actually submitted it for peer review. So groups that will ultimately review that will be the FDA. They'll very carefully look at all of the data to make sure that the test is efficacious and it's safe. We really want a safe test for our younger citizens of our community. It will ultimately go to peer review as well to be published. And so scientists who are expert in this area will review it. And then it will go to the advisory committee for the CDC, and they'll also review all of that data.
All right, and Dr. Bonds, we're on a roll with asking you specific questions. So there are just a few more. Folks did ask about the hospital's ICU data and how many children have been hospitalized at UVA or local hospitals with COVID as a primary diagnosis.
Yeah, so I don't have the numbers of the children that are hospitalized. We have had some children hospitalized with COVID. It's not a great number, that's what I've been told by our local hospitals. The UVA has a webpage where you can see the number of individuals that are hospitalized on any particular day, and then the total number of individuals hospitalized for COVID. You can also look at the VDH to see by region what the capacity for hospitals are and where they are with regard to that capacity. It does not break it out by adults or pediatrics. So I can safely say that many hospitals in our region are really at capacity. I don't believe that either of the hospitals here in our community are, but we have seen reports of other hospitals that are asking for help. And that just really emphasizes why it's so critical that everybody get vaccinated. So even if you have a breakthrough case and you're vaccinated, as others have said tonight, you will likely not end up in the hospital or with a serious case of the disease. So vaccines are highly effective, they're very safe, and it's the best way to keep our hospitals open so that if you have a different type of emergency and need hospitalization, that bed is there for you.
Well said. And I think that that is a perfect way to wrap up tonight's town hall. I will see if Ryan and Jen, do you have anything else you would like to share? Okay, great. All right. Well, Dr. Bonds, any other final words? I think you said it all, that we're encouraging folks to get vaccinated.
That's right. Really, there's lots of places to get vaccinated. You have a choice of 3 different very effective vaccines. If you haven't, today is the day to go online and sign up and get that vaccine.
Well said. All right. And thanks again for everybody who has participated and attended and asked questions live. I see there are a few other questions we weren't able to get to in time tonight, so please feel free to send us an email or call our hotline. I think some of the questions had a little more specific information in there, so it might be easier for you to email us and we will follow up with you as quickly as we can. And again, we will host another town hall once we have more information about the 5 to 11-year-old vaccines, and we'll continue to send out information about booster shots for when those become available. So thank you all for joining us tonight, and take care.